Hello, I'm Mark, physical therapist assistant at Physical Therapy and Balance Centers in Ruston. Dr. Jerry had previously taught us about the three major causes of back pain. Last session, I had spoke about bulging disc and given an example of what a bulging disc was and some major exercises or some common exercises we can use to combat that. Today, we're going to talk about degenerative disc disease and stenosis. Today, we'll give you some common exercises to deal with the degenerative disc disease and stenosis in order to help with the pain. Last time, we talked about bulging disc, and I used an example with a couple pieces of board and a balloon to show what a bulging disc looks like. Well, in the same way, I'm going to use the same kind of example to show you what degenerative disc disease is like. In degenerative disc disease or stenosis, arthritis, what we have is the disc is just squished out. It's just very small. There's not much left, and it's bone touching up on bone. So your disc touches each other and causes pain. Usually people who experience this have pain with any movement, any flexion, extension. They get their most pain relief in sitting or sometimes in standing with certain positions. What we want to do, we're going to attack that with three different methods. One, we're going to stretch the hamstrings, we're going to stretch the piriformis, and we're going to do some pelvic tilts. Okay, for a hamstring stretch, we simply want to take a belt. You can use any belt like a leather belt or a strap or a rope. We take our leg and keep the opposite leg locked down, keep the pelvis locked in. Bringing the opposite leg up, we can pull it up, make sure the knee is straight. The key is to keep the knee straight. We want to hold this stretch for 30 seconds in order to let the muscles completely relax so that the muscle doesn't snap back like a rubber band. Hold it for 30 seconds and do this for 3 sets with each leg. Next, we want to stretch the piriformis. The piriformis is the muscle in the hip, and this needs to be very flexible. What people tend to do is they'll rotate their back if they're not flexible in the hip. We want the hip to be flexible enough so that the hips rotate and the back stays stable so that the pelvis doesn't move. In order to stretch the piriformis, what we simply want to do is cross our legs as though we're sitting in a chair and crossing our legs. We take the knee with the opposite hand and bring the hip up and in. You should feel a real good stretch in your hip. You don't want it to hurt, but a good, hard, gentle stretch. We want to hold that for 30 seconds. If it's not enough, you can lift your opposite foot up off the mat and continue to stretch it until you get a good, firm stretch. All right, the third thing we're going to learn about are pelvic tilts. When you have degenerative disc disease or stenosis, you want to maintain a neutral pelvis. You want to keep your core nice and stable and tight at all times. Now, the pelvic tilt is not a stretch, it's not a strengthening. What it is, it's teaching the muscles where to be and how to stabilize the core. Let me show you how to do this. In the pelvic tilt, we want the back, the arch of the back, to go flat into the mat. We want the hips to roll forward. And in doing so, it's the same movement as though you're zipping your pants up or rolling the hips back, making the back flat into the mat. Once again, I'm Mark from Physical Therapy and Balance Centers. These are three simple things that you can do if you have back pain caused by degenerative disc disease or some arthritis. But the best thing you can do is call and make an appointment, and we'll get you set up to help you start out your new year right. This is going to be a tough one. Ruston and all right, cut. Standing, all right. No, that would not be good. You're going to put that in the outtakes, I'm sure.